we're looking at a good sitting position. So I've just got a few slides here about what I think about. I always start with the pelvic position, because if you get a child's pelvis well supported in a good position, generally that helps you sort both then the lower legs and their trunk and head and arm position. So here we're looking at the pelvis straight. The two red dots are the bony bits on the front of your pelvis. So look at the pelvis from the front. We want those straight to each other and not tilted back or forward. And then from the side, again, we want the pelvis as upright as possible, but not tilted forward or too far back. We look for a 90-90 seating position where possible, and that's where the knees are at 90 degrees with the feet supported with adequate weight to support the femur horizontally. So we want them to be putting some weight through their feet, but also through the bottom and the thighs. Hips should be neutral with knees slightly apart and in line with the hips. And this is, again, what I said is about this is what we want to achieve, but we need to take into account any child's fixed deformities or contractures, and get as close as we can to this whilst maintaining that comfort and the skin integrity and their function. From a spinal point of view, we want to make sure that the natural curves of the spine are supported and they're symmetrical. Then they're not leaning from one side to another, or forwards or backwards. And from the head point of view, just moving my bar, sorry, we're looking for a head in line with the trunk and their chin tucked. And that's really important when we're looking at feeding and breathing, because children in particular that have low trunk control and low trunk tone, the head is very heavy, and so we don't want their chin on the chest or their ear on the shoulder or looking up to the ceiling, because that makes it really difficult to swallow and also to control the breathing. And then we want arms and hands. So we want arms forward, hands where they can be seen on the tray or the table and where it's easy for them to reach and grasp things. We don't want arms caught behind the tray or an armrest. And if the child's bringing their arms around and getting them stuck there, we need to be looking at supporting around the shoulders. And what modular seats, some of them have shoulder protractors, which are just little pads that sit behind the shoulders to stop that, or pads on the back of the tray to stop the arm coming behind the tray. In a molded seat, we want to be looking at trying to sort of bring the mold further out to provide that support behind their shoulders. Okay, and then feet should be supported, ideally, and we should have weight going through them, and they should be flat on the foot plate with toes pointing forwards. For children